Okay, so we quickly trying to move to the next set of tests which we're trying to talk about, then also talk about the reasons why they do these tests in the hospital. So this is what is known as a finger to nose test. Then also we have the heel to shin test. Okay, so this is finger to nose. A patient is touching a particular place, coming back to the nose. You are just trying to check out the precision, Then heel to shin, you use the other leg, you bring it to the heel, you take it up to the shin. Do you understand? So these are two tests and they always help us to pick up things. So you should know that the two tests, they are bedside neurological examinations and they are always used to assess what? Cerebellar function and your coordination. So they help to dictate ataxia, dysmetria, intention tremors, all those conditions that you are tremoring, so you can't be accurate, So what's the procedure for finger to nose? This is finger to nose. So the patient is asked to touch their nose with their finger, then touch the examiner's finger. It could be the examiner's finger or it could be any particular spot on the wall or on an instrument or something, but something that is specific, you understand? So you repeat it several times, and sometimes you tell them to open their eyes, sometimes you tell them to close their eyes. Okay, so normal result is the patient is smooth, it's accurate, everything is cool, they are doing it, no stress. So abnormal result is they are missing their targets. It could be overshooting, it could be undershooting, Then heel to shin, this is heel to shin. So the patient lies supine and is asked to place the heel of one foot on the opposite knee, then slide it down to the shin, then also slide it down to the heel, slide it down to the shin. So they are looking at a lot of things, your accuracy, then also the power you have to keep this foot up. Do you understand? So the test is repeated on this other time you use the left side, this other time you use the right side. So normal result, the heel is moving smooth, no issues. Abnormal result, you now see that the heel is wavering, it's shaking, you also have issues, the person difficulties in being accurate, Sometimes you tell the patient to close the eye, sometimes you tell the patient to open the eye. So some patients are able to do it with their eyes open because they can see. Some patients, they miss it when they close their eyes. So the clinical significance is all of them will actually test if the cerebellum is working well, So they assess the coordination of voluntary movements. Okay. So any result shows that probably the person has stroke, maybe they have multiple sclerosis, maybe they are intoxicated on alcohol, maybe they have tumors or degenerative diseases that basically affecting the cerebellum.